In 1980s, the definition of COPD was mainly symptom-based, and the symptom being increase in the shortness of breath, sputum production, and cough. In 1990s, this definition changed, and this was an event-driven definition, and this denotes worsening of the COPD symptom, which necessitate changes to the normal treatment, which include antimicrobial therapy, oral corticosteroids, and inhaled bronchodilators. And in 2000, this definition was modified as an acute event characterized by worsening of the patient's respiratory symptom, which was beyond normal day-to-day variation. That's only moderate if it is treated with additional antibiotics and or oral corticosteroids, and severe if the patient required emergency room visit or hospital admission. Reported exacerbation. So this is the major pitfall that we are facing. What are the challenges? Exacerbation are likely to experience significantly impaired quality of life. The one thing is the mortality, the other is the long-term consequence. So, these patients are at increased risk of impaired quality of life, increased risk of future events, and present the next morning. Then, what we have to assess? We have to assess the symptom, the severity of the dyspnea, the important clinical signs like tachypnea, tachycardia, sputum volume and color, respiratory distress. We have to evaluate the severity by checking for important investigation. So history, examination followed by relevant laboratory investigations such as pulse oximetry, C-reactive protein, arterial blood gases. And we have to establish the cause of the event, whether it is by a patient having sudden severe worsening of their respiratory symptoms. COPD patients, they always have some degree of dyspnea, cough and sputum. So if there is sudden acute worsening of these symptoms, patient has decreased oxygen saturation, patient has altered mental status, if they develop acute respiratory failure, if they develop any new physical signs like cyanosis, peripheral edema, or if the exacerbation fails to respond to initial medical management. The patient has serious underlying comorbid conditions like cardiac. If patient develops respiratory or cardiac arrest, the patient has a very diminished consciousness or a very low Glasgow Coma scale, cardiac arrhythmia. The goal of exacerbation is to minimize the negative impact of current exacerbation and to prevent, not only to minimize the impact of current exacerbation, but also to prevent future subsequent exacerbation. In patient
डॉक्टर हुसैन बख्श कोलाची यूट्यूब चैनल शुरू कयूं
जी जी
Dr. Hussain Bash Kolachi YouTube channel will provide you the latest public health and other development issues related to Pakistan and other developing countries. Please do subscribe and share this channel. Khuda Hafiz.